Hello and welcome to this episode of Permission to Flow. I'm your host, Jessica Huang. And in this episode, I have the pleasure of speaking with the wonderful Dr. Jonathan Rosenthal. Jonathan was actually featured in a previous episode of the podcast in episode 35, so definitely go check out that episode as well. And in this episode, this actually is a little bit of a bonus episode. Back in August, Jonathan and I were approached by Yoga Love magazine to be featured in an article for their inaugural digital print issue. And we were thrilled to do so. And so we decided to have a little fun with it and shoot this kind of bonus content that goes along with the article. So go and check out the new issue of Yoga Love magazine. And I hope you enjoyed this conversation where we dive into the benefits that yoga has on conditions like depression, anxiety, and ADHD. Jonathan provides a lot of science-backed research studies, and we both also share a lot of our personal journey in terms of how it has impacted us. So stay tuned and listen in to this conversation that I have with Dr. Jonathan Rosenthal. Hello, I am Jessica Huang. I am the host of Permission to Flow, a career transition coach, and a Dharma yoga instructor. And today I am joined with Jonathan Rosenthal. So go ahead and introduce yourself, Jonathan.
Thanks so much, Jess. Hello, everyone. I'm Jonathan. I'm a neurologist in New York City, which means that I'm a medical doctor that specializes in diseases of the nervous system like stroke and epilepsy and Parkinson's and multiple sclerosis and so many more. And I'm also really passionate about yoga and studying yoga scientifically so that we can help people improve how they practice, teach, and advocate for yoga. And I host the Neuroscience and Yoga online conference with this goal in mind. I'm really excited to be here with you, Jess. I think we have a really cool topic about how yoga affects younger people. So I think we're talking about people between the ages of maybe 12 and 29 or 27 or something. Yeah, Jess, when did you start practicing yoga? You asked me this last time, but I don't know if I ever really asked you about it.
Yeah, so I started practicing yoga when I was 16 years old. My mom got interested in practicing yoga and then she brought me along. And it was funny because I remember when I first started, I wasn't super interested actually. I was kind of like, okay, mom, I'll go with you. And then I started doing it and I was like, oh, this is, and it was, I like couldn't even touch my toes when I started. And you think when you're young, like you're going to still be flexible, but I will tell you, I was already not very flexible. And so I started practicing and it became this regular thing that just was this space of calm and peace, I feel like, that I had in my life where it let me disconnect from the world and just be on my mat and be present. And I don't know if I necessarily intellectualized it that way at the time, but I just knew that there's this thing in my life and I really enjoyed doing it. And it just kept me going back and it kind of grew more and more and more. And it wasn't until I really found Dharma Yoga Center and Dharma, who's our shared teacher, where it kind of just took over my life. And now it's like I can't get enough of it. But yeah, I feel very, very lucky because I started very young, which you did as well. And so I think, we're very blessed to have had yoga in our lives for a very long time and to start at such a young age, because what we're talking about today is kind of those benefits of what yoga has brought us. So I think we are kind of uniquely able to discuss that of how impactful it can be. The younger that you start, it really does give you that time or that ability to have this thing that helps you with just dealing with life and all the ups and downs from through these very tumultuous times, I would say.
I'm so glad I asked you about your personal experience because now I have so many questions too. But I think we both have our personal experience, like our anecdotal evidence with yoga that it really helped us. Like yeah, for me too, like in my teenage years, I feel like it made me sleep better, it made me like a calmer person. I was super focused on everything I was doing. And yeah, I really felt like it made a difference in my life. And it's interesting because we both started kind of like in our teenage years.
Hmm.
There's a researcher at Harvard named Satbir Khalsa who's been studying yoga for decades now, and he flat out says so emphatically, "I think yoga should be offered at every school in America." Like that's just like one of his lines, and it's really really interesting to think about if that were a reality one day. And if every student really had exposure to yoga, because like you said, we're both really lucky that we were exposed to it, and it's so easy to imagine a world where you just aren't exposed to it, and you don't know uh, how to get started with these types of practices for self-regulation and self-control and discipline and all of it.
Yeah.
And I think the reason Sapir Khalsa is super convinced is because, he studied it himself, but there's so many people working on this, and there are huge papers published. I mean, there's a quality problem right now in the scientific literature on yoga, especially for some of the stuff we're going to talk about for children. It's really hard to do good research for younger people because there's a lot of protections. So it's, children are considered a vulnerable population,
Mm-hmm.
meaning you have to get like extra permission and go through extra steps to make sure that you're protecting them. And so a lot of the research on yoga is limited by that and not the highest quality. But there are two really large review papers published, one of them focusing on depression and anxiety for younger people, and the other one focusing on attention and ADHD, which I know a lot of people struggle with. And I think the numbers off the top of my head are like somewhere between 10 and 30% for all of those. So, like anxiety, depression, and ADHD in people less than 27. So, it's it affects a lot of people. um, and
Absolutely.
even if you don't have the like diagnosis, a lot of people experience similar symptoms. And all of the research on yoga, like it doesn't really there's no test, there's no blood test for depression, there's no blood test for ADHD, right? So a lot of the findings are really just measuring symptoms. And so for people who might have symptoms but don't formally meet diagnostic criteria, like there could still be some benefit through this. And what's really interesting is one of the studies looks at effect size, and effect size is this idea of, how powerful is it? So, for example, you could do a study and you could get 20,000 people in this study and you could get a significant result, but it might only improve things by 1%, which
Mm.
kind of sucks. And there's so many examples of like studies where that has happened. One of my favorite ones is there is this huge database of all the insurance claims that have been filed. And I don't know how many hundreds of thousands or millions of data points were in this study, but they basically looked at whether the doctor was female or male and whether the patient survived or not based on this
Oh,
enormous data set. And
okay.
they found that it was a significant result that if the doctor was female, the patient was more likely to survive, but the difference was like 0.01%.
Whoa.
And
That's wild.
it's like does that 0.01% matter? Like that's kind of it's a really good example of like a huge 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 data set kind of making the result seem significant, but clinically it's not that big of a difference.
Right,
So
right.
when we're looking at the effect sizes for depression, anxiety, and ADHD, some of the really helpful numbers that I think we can look at are so you can look at what's called inattention. So in ADHD, that's like one of the primary symptoms, right? Inattention. And I'm sorry, I'm scrolling to find the exact number. So the improvement for inattention was on the order of like 30%, something like that. which is much, much better than 0.01%, right? um, and usually for all of the yoga outcomes, that's really where the numbers lie, like somewhere between like 30 and 50%. So we call those like small to moderate effect sizes. Um, and that's really helpful to know. Like, the effects are measurable, observable, and they're small to moderate. So, um, yeah.
Wait, explain this a little more. So this 30%, like what does that really mean? Like you're
Yeah,
saying,
clinically, what does that really mean? It's hard to know exactly. Like, is it the difference between taking medication or not? Like, that hasn't been measured. So we don't know if people, maybe some of the studies looked at that, but the review papers that I've read have not looked at that. So and I'll just confirm that really quickly.
wait, and so we're talking about there's a 30% difference of like whether or not you're practicing yoga or not. Is that the idea? Or
It's
what? Yeah,
people
what
who
is
are
the
practicing yoga compared to
uh
not practicing yoga, and the
Okay.
yoga group has 30% less inattention, 30%
Okay.
less hyperactivity,
Mm.
30% less depression, 30% less anxiety, so on and so forth. And the number 30% is, I'm generalizing it, like the numbers are different for each of those, but they're in that 30 to 50% range across the board.
Interesting.
And it's also really interesting because they have so many different ways that they do these yoga interventions. Some of them are one on one sessions with a highly trained yoga therapist, and the student is, required to go 5 days a week or something crazy. Other ones are 2 days a week on a DVD at home on their own time.
Mm.
Doesn't seem to make that big of a difference. I mean, they did an analysis where they showed that maybe less practice was associated with slightly worse outcomes, but not that they had any direct proof of that. Like the mathematical proof isn't there. They could still be within the range of the same outcome. So yeah, every time people look at how much do you have to do, which school of yoga do you have to do? Is it hatha? Is it iyengar? Is it ashtanga? Is it hot yoga? Is it whatever? Every single time those things are looked at, it's like I don't know. It seems to be the same.
Interesting. Okay. Yeah, because I'm like, how long are these people who are new to yoga and then they go into this study testing it out, doing practicing versus other people who have not, it's like they all start with no yoga and then they try yoga.
Say that again. Sorry.
Okay. I'd be curious if we're talking about everyone that starts the study has never done yoga before, and
Oh,
then
I see what
within
you're
the
saying now.
study,
I
the
see what you're saying.
people are doing the whatever kind of yoga practice that they're requiring in the
Yeah.
study, right? And then
Yeah.
the other group is just continuing to not do yoga.
So usually this is part of inclusion and exclusion criteria. So you have to
Yeah.
decide before you start the study, are we going to allow people who already have a yoga practice to be in the
Right.
study? And usually the answer is no. Usually you exclude
Okay.
people who are already practicing. And so you would have kind of like a newbie population. As time goes on, that gets harder and harder because more and more people are practicing yoga. So maybe they say something like you have to not do your other yoga practices.
Sure. Well, and then there's the other question of going in. Is there the measurement of whether or not they have these existing conditions and it improves their conditions?
Yes. So some
So
studies
how
will
does
have
that work?
inclusion criteria that you have to have a disorder like depression, anxiety, or ADHD diagnosed by a medical professional. And in fact, I would say the vast majority of studies are like that,
Okay, so it's like they already had existing conditions and then they practice the yoga and it ends up causing
improving their symptoms.
30% of people have improvements in terms of their
No,
conditions.
no.
No.
It's actually not 30% of people, which is a
Okay.
really good question. It's on average, the quantification of symptoms goes down by 30%. So it could be that
Okay.
some people experience 60%, some people experience zero, but on average, it comes down by 30%. What percent of people are experiencing improvement versus staying the same versus worsening is another really good way to look at it. I haven't really seen that for this literature, but like for example, like that's common in the migraine literature.
Okay, that's so interesting. So the idea is that their symptoms improve on average by about 30% through the practice of yoga.
Exactly.
Understood. Okay, this is so interesting because when I think about it, it's like I for myself, I would say that I definitely had a lot of. It's funny. I feel like ADHD has become such a like so prevalent lately. I feel like everyone I know lately has been getting diagnosed with ADHD to the point where right before we started this conversation, I was like, do I have ADHD? It's been like a question in my mind lately. But I will say I've definitely had dealt with a lot of depression and anxiety over the course of time. And it was, I feel like when I wouldn't practice regularly, it would get a lot worse. And, I'm just talking from my own personal experience, but I've found that as I have deepened my practice, as I've practiced more regularly, I have personally found that it has reduced a lot of my depression anxiety. I mean, I feel like it's relatively minimal these days and to me it's a lot of it has been being able to not only be in the practice when you're there, but for me, it's really that, especially with our teacher, I feel like our training with Sri Dharma Mitra is called Life of a Yogi. And I feel like there's such a reason behind that, where it's like, how do you take all the learnings from the mat and bring them into your real life? And I feel like when we really adapt the mindset, the way that we practice there and bring that into our real lives, like that's where I have personally found that those benefits of improving or reducing depression, anxiety, ADHD, like all those kind of things, like really comes into being. I don't know if you feel similarly about that.
Um, it's very interesting because it's like the this is one of the theories about why yoga might work. It's like the coping strategies you learn to deal with the discomfort during the practice
Mm-hmm.
might actually generalize to how you deal with the discomfort of life.
Yes.
And yeah, it's makes sense. It's like a really good hypothesis. I don't know if
It
there's a
does.
if there's a way to really prove that. You'd have to see if yoga that's well, actually, I think it could be disproven because I think that there's plenty of studies that show restorative yoga is just as effective. Um, and so it might not be the secret sauce, though it may be like a component for some people.
Well, what I would say to that is that it's interesting, right? Different forms of yoga are going to draw in different types of students. And it's almost, in a way, I think of it as you're probably like different kinds of practices are going to give you different kinds of learnings. So it's funny that you mentioned that because literally this past Sunday I was actually saying that to my students where I was keeping them really in a pose for quite a while, and I was like, I want you to imagine like how can you find comfort in being uncomfortable right now? How can you keep holding it even while I'm talking, even while you're thinking to yourself that you want to get out of the pose, and really allow yourself to be here and be uncomfortable. And so I think that that's certainly a practice in our particular style of yoga and hatha yoga, but it's not in other styles, to your point. And so perhaps restorative is giving you other different benefits, and maybe it's still giving you a certain level of being comfortable being comfortable being uncomfortable, but I think different forms are going to give us different lessons, and it's almost, to me it's like by design, right? Where it's like, oh, this is what I need to learn right now, and so life or the universe is handing that to me in the form of yoga, which then is going to help me be able to have that lesson in my life.
I think by my experience, I agree with you. Like people
Hmm.
kind of fall into the right practice at the right time. And, sometimes people need naked yoga or like whatever kind of yoga they're doing. And other times people need like more kirtan or jnana yoga or karma yoga. And I do think that people really do kind of fall into the right practices. But I think another thing that I actually vehemently disagree with now is that you should do the practices that you like. Um,
Mm,
because I think also just by like personal experience, like there's plenty of things that I'm like, I don't like this, and I still benefit from kind of forcing myself through it a little bit.
yeah.
But I can actually point to a study now. So there's this randomized control trial where I think we talked about this last time, maybe actually, or maybe I wasn't obsessed with it yet, but I've been obsessed with it for a few months now. So they randomized older adults to either doing, they were either allowed to choose yoga or cognitive behavioral therapy, or they were forced to do yoga or cognitive behavioral therapy, meaning that some people
Mm,
got to choose, some people, meaning they chose their preference, and other people
right.
were just told this is what you're going to do.
Yeah.
And so which do you think would do better, when you get to choose or when you are forced?
Hmm. That's interesting. So I mean like I like the idea of agency, but I also think that it's like when it's almost like when you're forced to do something, it's like you can't rely on the fact that like the one feels more comfortable. So I feel like you might end up with the thing that might be better for you even though you can't see it.
Yeah. And I think what it also highlights is it really doesn't matter if you like it. Like
Mm,
the people who did yoga when they were forced to, even though they really didn't seem to have a proclivity for it, had the same outcomes. So it just seems to work. Like if you do the
right.
practice, it just seems to work. That's it. And what is the practice? Like the consensus of what the core components have to be are postures held for, you know, maybe 30 seconds, maybe 60 seconds, somewhere in there seems to be the range. An attention to the breath and an inward awareness, relaxation and meditation. And I really think the literature is going to start adding ethical rules and personal observances. And I think that's like really what we know in all the yoga studies seems to be the necessary components.
Interesting.
And then for, younger people in particular, like you were saying how ADHD just seems to be like super, super prevalent. And there's a lot of debate like, is there something changing about humans? Is there something changing about our environment that's causing this? Is it exposure to something? Is it social media? Is it like instant gratification from so many things? Um, and yeah, no one knows the answer to that, but we do know the phenomenon exists. And then if there's a lot of arguments for and against taking medication for something like that, especially at a young age. And so having an option like yoga to treat or at least help with the symptoms of these diseases is really powerful. And it's not at a point where yoga is in the guidelines for depression, anxiety, or ADHD in younger people, but it is for certain diseases. So, for example, for cancer, yoga is considered adjunctive treatment to help with mood symptoms. And
Mm,
so it kind of makes sense that it would help with depression and anxiety in kids, even if the studies aren't, as well developed as they are for the cancer population. And I'll say that the studies that have been done for depression and anxiety in kids were across all different disease populations. So let me just quickly look at this because I was really interested when I read this. So usually in a study, they're going to say like inclusion criteria, perfect. Um, so the studies were from all over the world: United States, India, Germany, Canada, Iran, Colombia, and the participants. So they had a range of diagnoses, including type 2 diabetes, cardiac diagnoses, burn injuries, cancer, eating disorders, irritable bowel syndrome, cystic fibrosis, sickle cell disease, vaso-occlusive crisis. So if someone's not familiar with that, it's for people who have sickle cell disease, and then they have an incredibly painful event where a blood vessel gets blocked, and it usually leads to like death of some tissue. It's often like the spleen or a bone, and it really, really, really hurts. Like really, really, really hurts. Polycystic ovarian syndrome, autism, people who are in an inpatient psychiatric unit, so people who are like pretty severely sick with depression or anxiety, people who were residents of an orphanage, people who were at an elite music summer program, right? So these are all the different settings that these studies came from. You can see it's very diverse. And so,
Absolutely.
kind of interpreting from all of them, it's like, yeah, it seems to work like no matter who you are. Like if you have a really bad disease, if you're in a ton of pain, if you're in an inpatient psychiatric unit, if you have autism, if you're at an orphanage, if you're like super rich and go to an elite summer music program, like it just seems to work.
All the above. It helps everything. I mean, that I feel like we could speak to that feeling of like, I feel like yoga helps everything. It does feel that way in many ways, right? Because it has this innate, I think about how much it's like we don't think about if you just break down yoga into like just the main things about it, right? It is helping us connect with our breath. It is helping us move our bodies. It is helping us kind of like twist and do all these different movements that are in essence kind of like breaking up all these like moving everything within our bodies that can feel like all this like stuck energy or stuck whatever is going on there. And so if we think about just from its core, which is why it's like it doesn't really matter what type of yoga, but every single form of yoga is helping you in some way, shape, or form connect to your body and connect with your breath. And I just feel like those two fundamentals alone is what is helping us like be able to then assist in all these different diseases, all these different things, help our mood. You know, I think so much about how just taking long, deep breaths alone is what can calm people's anxiety. Like, as someone that has been a very anxious person throughout their lives, I'm like, well, when I feel myself like getting anxious, it's like, well, my breath is getting really short and I'm getting like, you know, I get tensed up and everything. And it's like, well, yoga alone is going to help me take long, deep breaths and relax my muscles. And just that physical ability to do that is then helping my brain trigger to relax my anxiety. So it's just it's so interesting to think about how it's like, yes, we can apply it to a million different things because when you get back to the core of what yoga is helping us do, well then of course it's our training ground for our ability to have these moments in our lives where depression, anxiety, ADHD, like all these things are bubbling up to the surface. And it's like, oh, when we remember our practice and we come back to that, we can bring ourselves back to that place of calm, balance, and center.
And I totally agree. It like I'm just gonna add one thing to what you said, which was
Please.
it seems to help everything, and I think that's so true. And I just want to add, it doesn't seem to cure anything. Like it seems to
Mm,
help with so many things, but it's not like a panacea in any way.
sure.
And it's like it's so helpful when you think of yoga that way. It's like, okay, I'm gonna continue like doing the things I need to do to take care of this body and mind, but I have this practice to help. And
Yes. We
the
talked about this, I
yeah.
remember.
Yep. And so I also think it's really important to look at the risks. So when I was going through the adverse events reported in these studies, I saw one, which is the first time I've ever seen one that I actually think was related to yoga. And it's actually quite interesting. I might need to dive more into it at some point to see exactly what happened. So there were a few things that were like definitely not related to the yoga. Like for example, in the sickle cell study, like someone had a sickle cell crisis, which like of course like that happens. Like if you have sickle cell, you have
Sure.
sickle cell crises. Um, the but in one of the studies during an inversion, one of the children had what's called a Valsalva retinopathy, and so it's like you bleed into the back of the eye, and the child I'm saying child teenager was temporarily blind for a few weeks after that. It got better, which is like usually what happens with that. But that's the first time I've ever seen that reported in a study, which I thought was really interesting. So I want to know more about this individual. Like, did they have something that predisposed them to that? But just the fact that they were in an inversion and it happened, like, really
Mhm.
makes you think, like, okay, this was probably related to the yoga. Um,
Interesting.
But to put it in context, that's the first time I've ever seen an adverse event that I'm like, that's probably from the yoga. And when I say adverse event, like minor sprains and injuries that people get better from in a few days to a few weeks, I'm like, I don't really care about those. But something that leads someone to like be hospitalized or get blind or like have permanent injury or disability, those I really care about. And I almost never see the serious ones. This is like one of the first.
Right, right. Yeah, I mean, I've certainly never heard of such a thing happening from yoga, but like it can if you have pre-existing conditions, I'm sure.
Right.
Yeah.
And there was one other thing I wanted to mention, which was in the ADHD population, there are a few studies that look at actually giving the parents yoga. And believe it or not, having the parents do yoga helps the children. And
Hmm.
it really just helps like everyone not be as stressed about what's going on and kind of
Mm.
um, have better self-regulation and coping strategies dealing with the situation of, a child with ADHD.
Interesting. Yeah, I it's interesting because like I've heard of random places around the country where have they teach meditation to like children. They have it in classrooms or whatever. And as you mentioned, it's obviously there's a lot of things around regulation in terms of getting that in the door, but there is such an interesting benefit of having the like children like learn to sit still and be able to kind of go inward. But I love what you said there about kind of adding in the parents and making it more of like a together kind of environment and how that is benefiting everyone, right? Of bringing that sense of calm. I mean, you're talking about yoga. I'm now talking about meditation, but of a similar vein. So I'm curious, like, what your thoughts are around that and like having meditation in with children.
Yeah. So I think I'm not a child yoga teacher, but I think it's probably really hard to get children into it. Like there are tricks. Like everyone who does it, I think has tricks to like get them really into it. And I think meditation for children looks different than meditation for adults. Like what they're focusing on and how they do
Sure.
it is a little bit different. Um, but it's really cool to see how you can adapt it to younger people. And I think that the same thing has to happen for people in their 20s too. Like people who are really used to scrolling on Instagram and instant gratification, like maybe you have to adapt meditation to make it more comfortable. Um, and I don't know exactly what that looks like. I'm sure there are people who are more experienced with that. But I think that, uh, yeah, I think that's really all I have to say about it. What do you think?
Well, you bring up a great point, which is this idea of trying to find the thing that suits you and you were talking earlier about like being forced versus choosing and like doing things that are uncomfortable versus like the one that naturally kind of draws you in and I think it's almost like a mixture of both in my mind where it's like I think it's funny because I think some people can look at certain types of yoga and judge them or think that, oh, this isn't really yoga or whatever. And it's been interesting because I have a different perspective on it than maybe a lot of other people. Some people are like they're very staunch where they're like, if you're not doing super traditional yoga, like it doesn't matter or it doesn't count or something like that. And I have a different perspective on it where to me it's like, well, if it got you in the door and it opened up the possibility of yoga to you in a way that like you otherwise would not be interested in it, then I personally do not see it as a bad thing. So I'm like, I might personally not want to practice hip hop yoga, but if that is what gets you to move your body and do yoga postures is like because it's going with music that you like, then why would that be a bad thing? And then over time, maybe you will start to open up to other forms or, and deepen your practice or whatever the case may be. And so to me, it's like, it is kind of a balance between maybe starting with what draws you in and what naturally feels like, oh, this feels good to me, because it has these elements that I am naturally drawn to, and also pushing yourself out of your comfort zone and doing things that are not necessarily going to be the things that you like to do. I agree with you wholeheartedly around that need for that, and pushing yourself out of your comfort zone is so important. And I think a lot of people are so hesitant around it, and it's like, oh, but pushing yourself out of your comfort zone is how you find the things that will really benefit you and really, get, I don't know, create change in your life, like make your life richer in my mind. And it's certainly something that I preach in all the work that I do. And so it's interesting because I think it's so important for us to do both, right? Like start with what flows, but also go outside of that comfort zone and push yourself at it. Because to me it's like, yes, I love doing inversions, or let's say I love doing wheel pose, like that one. I'm just like, it just feels like fun to me every time it gets called. But I also have been like really pushing myself in Kormasana lately because it's been the most challenging pose for me, and I ignored it for so long, being like, I don't want to touch this, I'm not good at it, and so therefore I'm not going to really try. And it took me a long time to be like, no, I need to change my mindset around it. I need to look at it as appreciating the challenge and appreciating the fact that this is my practice ground of being uncomfortable, feeling like I'm no good at something, and saying I'm going to do it anyway. And I see how the way that I have approached that pose has ripple affected into the rest of my life. And I'm very grateful for it now, where it's like, yes, this used to be the hardest thing for me, but now I appreciate all the effort that has taken me to get to where I am now, and I am willing to do that more and more throughout my life.
I
I
love
went
it.
on a tangent,
No, but
but
I love it. It was like a really good personal example. Um, yeah, and you could totally imagine something similar for someone struggling with really bad social anxiety. Now, listen, I don't want to, I don't have any scientific evidence to back this up, but you could imagine, like, okay, like when I tried this posture I was really scared of, it went okay, even though I didn't do it perfectly. Maybe now I can like go to that party that I was afraid to go to, and even if it doesn't go well and I kind of embarrass myself, it'll still be okay. That's a huge generalization, right? But you can just kind of see the same kind of uh, ripple effect you were mentioning, how what people are doing in yoga practice can affect their approach in the rest of their life.
absolutely couldn't agree more.
Last question that really comes up a lot is why? Why does yoga have this effect for mood? Why would it have it for attention or cognition or anything like that? And the short answer is like, we really don't know. Okay. It probably is going to be the case that yoga is what we call a pleiotropic intervention, meaning it works by many mechanisms. That's what
Mm.
pleiotropic means. So it's like,
Okay.
it's not like because yoga improves stress, it improves everything else. Like there are plenty of examples where people don't have improvements in stress, but still have improvements in everything else. So it's not going to be like a simple model. It's a very complex model of how yoga works. And so some of the thoughts for how yoga might work for mood, and this is based on work that has been done mostly in adults. Um, so the first is by affecting stress physiology, which I think everyone can really relate to. If you ask people why do you go to yoga, the vast majority will say to deal with stress.
Mm.
And stress is a very cool topic. Everyone who thinks about stress almost always just thinks it's a bad thing. But in fact, stress is like a really normal thing. It's how our body deploys resources. And so I think the best way to think about stress, it is a brain determined process that affects the whole body in order to deploy resources and adapt to a stressor.
Hmm.
And those stressors can be physical, so it could be things like injuries or infection or hunger, or it could be things that are more psychological, like grief or financial strain or something like that. And once that happens, like once the brain determines that something is stressful, there's a huge cascade of changes. And these changes actually, people think stress is bad, but these changes can make you learn better, right? If you're stressed for an exam, you can actually pay more attention and learn better during that. If you are way too stressed, yeah, of course, you're not going to learn as well. But for stress, there always seems to be like a right dose. And this has been shown over and over and over and over again for over 100 years actually. Like it was, I think, Yerkes and Dodson who like first plotted how performance varied with the amount of stress, and it seems like the middle is the best. And this brain determining part of that definition I gave, like how does the brain determine whether something is stressful or not, that's the hardest part of the equation, and that's probably what yoga affects. Meaning that we don't perceive things as threatening or as stressful as a result of yoga practice. And if we do perceive them that way, people have the tools to self regulate and change that perception. Meaning that, like you said, if you're noticing you're really anxious and you start breathing really fast and your body gets tense, well, if you do slow, deep breathing and concentrate on one body part at a time, relaxing it, you kind of like have a tool to undo that stress and bring you back to that middle point of optimum stress. So that is the stress physiology part of this. Stress physiology then works through things like cortisol, so it works through hormones, but it also works through nerves, like the sympathetic nervous system. And these have been measured like super robustly. Basically, every marker that you can think of for stress, yoga has been shown to affect. This is where the literature is like pretty unequivocal. Yoga affects stress.
Right, right. I think that's so interesting. I love what you said there about stress as not being a bad thing because I think it is really important to recognize that because we've labeled it as bad. And I love how it's true. It's kind of like it's not hard, it's not easy to like quantify exactly what it is about yoga that helps us with our stress, but it absolutely does help us manage it. And it's almost like having it's more so to me as having a better relationship with our stress and being able to kind of manage it, say like, okay, you're there. I don't want to get like hyperactively stressed out, but it's going, okay, it's almost like a what's the word I'm thinking of? Like an indicator where it's like I'm stressed out about something, I'm recognizing that I'm stressed out about something, and therefore it's, physiologically giving me certain things that are going on, and I'm able to adapt to the situation knowing I'm stressed, right? To your point of it going, oh, I'm stressed out. Why? Because I have an exam coming up. Well, what can I do about it? I can prepare for my exam. I can study. I can, do these things around it. And it's important because if we don't have that stress, then we will not take those actions maybe and then do worse, right? So it's seeing it as almost it's a signal. That's the word I was thinking of. As a signal that we can then respond to and utilize to our benefit instead of as this horrible bad thing that is creating problems in our lives. And so I agree with you where it's like if we were able to utilize yoga in terms of like maintaining that lever of saying like, okay, how do I get to like I think they talk about it being like a bell curve, right? Maybe you had told me about this. But stress is being a bell curve and wanting to be at kind of like this like optimal amount of stress where it's like not too extreme where you can't function and it's not too little where you do nothing, but instead being in that like perfect zone where it's like, okay, I have a good amount of stress, I'm going into action, I'm doing what I need to do, and having it be of to your benefit essentially.
Yeah, and it's super cool because we know that stress affects everything about our physiology. It's like kind of one of our central signaling cascades, and if you measure things like blood pressure, cholesterol, metabolism, like if you measure changes in heart rate, if you measure like all of the stuff that you can measure related to stress, yoga interventions seem to affect. And it's very unifying that yoga really affects the stress physiology.
Interesting.
And then stress physiology, of course, has so many effects on mood and on attention. And so that is why, that's why this could be a really potential mechanism.
It's that ripple effect that we were talking about.
Yeah. The next potential mechanism for how it could affect mood is neuroinflammation. So more and more it's being recognized that levels of we should just talk about what inflammation is. Um, so inflammation is like I'm going to use very similar definition to stress. It's about bringing resources to a particular part of the body in order to uh, recover from some damage, usually. And it can be appropriate, so you can have inflammation that like we're all like, yeah, like don't do anything about that inflammation, let it be. Like if you get an infection in your arm, like you kind of want inflammation there, you want to fight that infection. But of course there can be inappropriate inflammation, so you can have inflammation where the body is attacking itself, like for example in something like rheumatoid arthritis or lupus or multiple sclerosis. And in that kind of inflammation, you're like, okay, let's stop that inflammation. Well, one of the inappropriate inflammations that's been potentially linked to mood is there are markers of increased brain inflammation in depression and anxiety. And so it's more and more thought that maybe this is playing a role in the disease process. And there aren't many, but there's a few studies looking at how yoga affects these markers of inflammation, and yoga seems to improve them. So again, this could be another potential mechanism by which yoga is helping with mood and attention.
So just to clarify, when you talk about this idea of where inflammation has become like the body attacking itself, what is kind of the discourse of what causes that to occur? Is that
Yeah,
stress related or where does that, yeah, I
so it's
love your
it's
thoughts.
different for every disease. It's every
Sure.
disease has its risk factors.
Mm-hmm.
The diseases I know the best are going to be like multiple sclerosis because I'm a neurologist. So like for example, for multiple sclerosis, there are a few really big risk factors. One of them is genetic. So if you have a certain gene,
Mm-hmm.
then this gene is really related to how the immune system learns. And so, if you have a certain variation of this gene, it probably affects the way the immune system categorizes what it should attack and what it should not attack. And so, it starts identifying body signals, like signals that you should not attack, as bad. And then it starts to attack them. So that's one risk factor that's genetic. Another one is infection. So, a huge risk factor for multiple sclerosis seems to be the Epstein-Barr virus. So, being infected with Epstein-Barr virus infects the very cells that make antibodies. So, make a part of the immune system that's super important. And how does MS work? Well, it's by antibodies. So, Epstein-Barr virus seems to disrupt how B cells are making these antibodies and then potentially predisposing them to attacking the brain. Another risk factor for multiple sclerosis is distance from the equator. So if you live near the equator, much lower risk of MS. If you get further away from the equator, higher risk of MS. People think it's because of sun exposure and how much vitamin D you make. So
Okay.
people closer to the equator probably have more vitamin D and less MS. But it's been tried to give everyone vitamin D and see if can treat MS, and it doesn't. So hard to say for sure, but that's just another risk factor that we know about. Um, and I'm trying to think if there are any others. There are definitely others, but I think those are like kind of the main ones. And really, what it is the immune system is constantly deciding, do I trust this or do I attack it? And
Mm.
because it's exposed to things from your body all the time and things from not your body all the time, and it has to decide what to attack. And whatever causes autoimmune disease seems to just shift it towards attacking things that it shouldn't.
That's so interesting. Okay. I had to pick your brain on it because meanwhile, I've had bouts of like inflammation that have come up usually during like incredibly stressful times. Like when I was burned out in my job, I had like a horrible rash on my neck that wouldn't go away for 4 months. And so it's like my body was like attacking itself, I guess is what you're saying. So that's why I was like, well, I don't have a genetic predisposition. I don't have, it's not like I had certain risk factors, but it was like my body's reaction to what was going on in that moment. So I was just like, I was curious, or
Yeah.
now I'm curious what your thoughts are around that.
Yeah, so in terms of like skin condition, blah, blah, blah. But the the other thing to know is stress and the immune system are very closely linked. So, um, you know, one of the things that stress can do is either suppress the immune system or turn it on more. And it just varies depending on the context. Sometimes you hear people like stress suppresses your immune system, which is true in some contexts, but in others it actually enhances your immune system. And
Mm.
um, it definitely is the case that stress can worsen autoimmune conditions. Everyone with an autoimmune condition will tell you that. So I don't know
So
what
that
the
would
lab.
actually, sorry, just to clarify, that would actually be your immune system turning into overdrive from
Correct.
stress. Got
Correct.
it. Okay, interesting.
And
Sorry to cut
I
you
don't
off.
know what the
Continue.
rash was, but if it was something like psoriasis, well, psoriasis is an autoimmune condition, and so it would make sense that it could be worsened by stress. If it's something like eczema, which is more like dry skin, I think that could also make sense because usually people are going to be like dehydrated when they're stressed and like all that stuff.
Got it. Yeah, it was something along those lines of those two. Interesting.
Um, Another mechanism by which yoga might affect these is neuroplasticity. So just the ability of the brain to change in response to different environmental cues. And there's accumulating evidence that, it's hard to measure neuroplasticity in humans. Like you can't put electrodes into people ethically and, implant their brain. Only if they have epilepsy can you do that. And so one way to measure neuroplasticity is with molecules that kind of signal neuroplasticity. And there's this amazing study from 2014 where they looked at brain-derived neurotrophic factor, and it was in India, so they were able to get people to practice yoga like really intensely. I think they practiced an hour a day for 3 months, but their brain-derived neurotrophic factor increased dramatically. So people who were in their 40s had brain-derived neurotrophic factor more like people in their 30s, and people in their 30s had brain-derived neurotrophic factor more like people in their 20s. And so it really looked like it was having a big effect on neuroplasticity. Another way to measure neuroplasticity is to look at the size of brain regions, and it seems like the hippocampus grows with yoga and meditation practice. So, just kind of more evidence that uh, that neuroplasticity could be playing a role. Okay, the
And what
other
is the role of the hippocampus?
memory, a lot of things, but primarily considered a memory center. And if you look at people with depression, they tend to have smaller hippocampi, and markers of neuroplasticity are reduced in people with depression and anxiety. Another one is prefrontal cortex connectivity, so the ability of this executive function part of the brain, the prefrontal cortex, which really is about goal-oriented reasoning, like what are my goals right now and how are my current functions supporting those goals? Well, the prefrontal cortex talks to so many parts of the brain, and based on the imaging evidence that we have, it seems like yoga and meditation help the prefrontal cortex regulate other parts of the brain. And so it makes sense then that this could really support someone's ability to regulate their mood and their attention with this practice. I'm being so vague and fast. I'm sorry. I do have to go soon.
All good. All good.
And then the last one is neurotransmitters, and this one is like really the hardest to measure again because you can't like stick all kinds of things in people. But neurotransmitters are the signaling molecules in the brain that allow for communication to occur between cells. And there's a really good paper from Chris Streeter from 2000. There are multiple of them, but they're from the 2010s. And she basically measured this inhibitory neurotransmitter, GABA, in the thalamus with yoga interventions and showed that there was more GABA And GABA is really about like refining. I can't get into this, but GABA is just like a really important neurotransmitter for let's call it signal to noise, like making the brain have better focus. And um, this could be another potential mechanism. And then there's this one study that I really like where they looked at the byproducts of serotonin, and they just measured it by pulling spinal fluid out and measuring it in there. So kind of like the waste products of serotonin, and there were more waste products of serotonin. So presumably more serotonin with yoga practice, which is serotonin is thought to help like regulate mood. So these are just some of the potential mechanisms. We don't know exactly why yoga has the effects it does. We still need to really confirm that yoga has the effects that we think it does based on these studies, but it could be through regulating stress, regulating inflammation, regulating neuroplasticity, improving prefrontal cortex function, or changing neurotransmitters. And honestly, it's probably all of them, right? Yoga is pleiotropic, probably. So it's probably through all of these mechanisms working together that yoga really has such a important small to moderate effect size on depression, anxiety, and attention for all
Right,
age
right.
groups, but also young people.
Yeah. Basically, the moral of the story is yoga is doing all kinds of good stuff to you. Because I was thinking about, I'm like, you also think about if you take apart the pieces of yoga, right? If you think about like meditation versus pranayama versus asana versus, like all these different things. And it's like, well, it's like, well, each of those parts can like affect different aspects of yourself. And then like, all the ways that they're affecting you. It's all different parts of the brain being fired off and changing and morphing. But yeah, it's hard to pinpoint is kind of I think the moral of that story. But it is amazing just that ripple effect that we've been talking about, that it really is every little all of these different practices are really impacting us in so many different ways beyond what we can really quantify and study or really be able to see. And it's yeah, it's really it's incredible, and feel very 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 fortunate to have yoga in my life and be able to benefit from it and be able to share it with so many people. I'm sure you feel the same.
Yeah, no, I definitely feel super passionate about the practice. So
I think we can wrap up here. It's so funny. We were trying to record essentially 5 minutes worth of us talking, which turned into an hour worth of us talking because that's how it goes when it's me and Jonathan, of course. But I could talk to you all day long. I think we could have a million of these conversations and still have more to talk about. But it's just been such a pleasure having this conversation with you and sharing some of our knowledge and experience with such an incredible practice that we are so blessed to have in our lives. So thank you so much, Jonathan, for having this conversation with me. It's been an absolute pleasure.
thank you so much, Jess. It's always so much fun. I completely agree. Like the back and forth it could go on forever. Great knowledge, great experiences to share. So
Absolutely. Thank you so much for tuning into this episode of Permission to Flow. If you enjoyed this episode, then hit the subscribe button and give this video a thumbs up. And if you want to learn more about working with me, then go to my website, jessicahuangcoaching.com. Link is below. And remember, the world needs what you will create.